To have hereditary breast cancer essentially means that somebody is born with a gene mutation that increases their risk to develop breast cancer or perhaps other types of cancer as well. The most well-known and well-described hereditary breast cancer syndromes involve the genes BRCA1 and BRCA2. They were really the first hereditary breast cancer syndromes discovered, but since that time, we've now come to understand that there are many genes that are potentially involved in hereditary breast cancers, all of which increase the risk of breast cancer to varying degrees. For women that are at increased risk to develop breast cancer, we often do what we call enhanced breast cancer surveillance. So essentially what that means is we add in a breast MRI as a part of the breast cancer surveillance. Many patients that come to our clinic and have a strong family history for breast cancer have this question of whether or not they may have been born with a gene mutation that increases their risk to develop breast cancer. That does not mean that they have a breast cancer, but it could mean if they have a genetic test that's positive that they have an increased risk. If we identify that gene mutation and we know that individual in our clinic is at increased risk, we will work with them to closely develop what we call a cancer risk management plan. For people that come to our clinic and often express that they are very overwhelmed by the potential of identifying the knowledge that they could have been born with something that increases their cancer risk, what I share with everybody who understandably is feeling overwhelmed in that moment as we're discussing this, that the knowledge is really power. I think a lot of people come to our clinic with the perception of, if we identify genetic cancer risk, what in the world would I do about it? And will that information just be a burden on me and my family members? And the reality of it is, the knowledge of that information really allows us to open the door to cancer prevention strategies, cancer screening strategies that otherwise the general population would never have access to. And so what I really tell individuals, again, feeling overwhelmed by this information, that if we have the knowledge that there's a genetic cancer syndrome, we can take much better care of you and actually markedly decrease the likelihood that somebody would have a negative outcome from a cancer diagnosis.